Like men who 95% of the time if they lose their hair, it's because of genetic predispositions. Women, it's abnormal for a woman to lose her hair, and most women won't stand if they are losing their hair. So that's probably what we see the majority of the time that comes into the treatment center.
We've got a picture of June a year ago before she went through your testing and treatment. Let's take a look at that and explain to us what was going on, Dr. Rodney.
Well, when June first came to see me, if you notice right around her hairline, the temple area and the frontal part of her hairline, she had begun to have what we call a receding type of hairline, whereby the hair around her hairline had begun to start receding back. When she filled out a case history profile so that we could see why she was particularly losing her hair, that's how we were able to identify that this is what the problem was.
Diet? Come on now.
Yeah, you'd be surprised how diet really comes into play. You have to take in the right type of nutrients into the body. We call them macronutrients and micronutrients, or to break it down even more simpler, proteins, carbohydrates, lipids, vitamins, and minerals, in some cases even herbs.
No, really. We've got some other pictures to show you. The first is of abnormal shedding. Let's talk a little bit about that and what causes it.
Yeah, this is a disorder which we call diffused hair loss. The word diffuse, first of all, means that it is thinning throughout the hair. This was a particular client that had just had a child. After childbirth, a woman can lose up to as much as 60% of her hair. There are other factors that could cause it. Menopause can cause problems. In some cases, a high fever, thyroid disorders could cause this particular problem.
Also, patchy baldness can be a problem for many women.
Yeah, patchy baldness, this is what we call alopecia areata. Alopecia areata means that you actually get just spot patch baldness, and it can actually move around the head. It can start in one part of the head and it can actually move around. In this particular woman right here, she actually had 3 different types of bald spots. This is just one area that we took a photograph, but she also has one on each side of the head also.
And women, we try and conceal it. Our hair is our crown, and we don't want to lose that. Men, it's more accepted, but with a woman, it certainly is difficult.
Yes, it was devastating. I was at a panic. I was at a loss. I'm losing my hair. What am I going to do? And at a very young age, it's devastating. It's very traumatic.
And we try and cover it up instead of seeking help.
In some cases, you can cover up. In some cases, you cannot.
We've got a couple more examples of abnormal hair loss. Let's take a look at the next one. What is this one?
This is a disorder which we call cicatricial alopecia. Cicatricial alopecia, if you notice, you can see the scarring around where the hair is beginning to start thinning. Now, cicatricial alopecia is a disorder that could either be viral, it could be bacterial, or it could be fungal. And when you look at it under a microscope, you can actually see the scarring that's beginning to manifest here in this particular area.
We have one final picture to show you this afternoon.
Yeah, this is trichotillea mania. Trichotillea mania is actually where a client will actually just sit up and twist and pull the hair out of the head. You might think that this is not something that would be normal, but nerves a lot of times cause this.
And in each of those, the hair could be restored.
In most cases, yes, they can. The only ones that we don't really give a whole lot of hope is the what we call androgenetic alopecia. That's the male pattern and the female pattern type baldness.
A couple of tests that you give to your clients when they come and see you. Talk about that briefly.
We give them, first of all, what we call a nutritional type test, and this is something they can actually take home themselves. Basically, what they do is they take this particular test home, and it helps them to be able to appreciate the type of foods that they're eating. Certain foods can deplete the amount of minerals that you have in the body. And another type of stress is what we call a stress test to see how their body is really responding to tests. Both of these tests they can actually do at home themselves.
Amazing.
And then they bring these numbers back into us.
And June, I'm sure you're feeling much better these days.
Most confident.
Congratulations to you. Okay, well, we had such an overwhelming response to last month's segment on hair loss that we invited back trichologist Rodney Barnett.
About 20 million Americans needlessly suffer with hair and scalp disorders. Many simply don't know where to turn. Rodney Barnett is the president of the local chapter of trichology. The studies the cause of hair loss and scalp disorders by looking at what's going on internally. Good of you to join us today.
Thank you, Mr. Dean and Ms. Jackson.
The last time you were here, we talked about hair loss. Today, we're going to focus on scalp disorders. What are some of the contributing factors to scalp disorders?
Some of the contributing facts would be external factors, internal factors would be contributing factors, stress, person's diet. Those would be contributing factors.
We're talking about dandruff, psoriasis, and the list goes on. Let's take a look at an example of, let's start with dandruff. Want to start there?
Common dandruff type.
All right.
This is a common dandruff type. This is probably the single most common complaint that we have from persons who come into the treatment center. Now, common dandruff sometimes is misconstrued as being everything from residue that's in shampoos to a allergic reaction that people sometimes have when they use the wrong type of harsh type shampoo.
What is it exactly? Dry, flaky skin, or?
Yeah, what it actually is every 30 days you get a new scalp. And when you get this new scalp, it happens because the cells accelerate from the bottom part of the epidermis, and as it accelerates to the top part of the scalp, new cells are being formed. So old scales are just actually leaving the scalp.
I can wash my, I guess I shouldn't admit this, but I can wash my hair, and I mean, and I still have a flaky scalp. And so I guess I haven't found an answer. Have you noticed? No, just kidding. But it's something that can be very embarrassing for men and women.
Essentially, though, you're saying it's a normal function of the human body.
Right, every 30 days. Now, in some cases, external factors or internal factors can actually cause this acceleration to accelerate at a much faster rate. So instead of it actually taking 30 days, which normally if it took the whole 30 days, it would go unnoticed, it can actually accelerate so fast that it could actually accelerate to 14 days, 7 days, in some cases even 2 to 3 days.
Okay, so I can't just put Afro Sheen on my scalp and it'd be okay.
Will not do the job.
Vitalis doesn't work either. We've got one that's almost become a punchline. They always used to say the heartbreak of psoriasis. It's a similar condition, but it's not exactly dandruff. Tell us about that.
Yeah, this disorder, psoriasis, is misconstrued a lot of times to be dandruff because it looks so similar. If you actually were to actually take a flake and look at it, it would look exactly like dandruff. The only way that you'd be able to differentiate that it is not dandruff is to actually look at it under a microscope. When you look at it under a microscope, you can actually see inflammation there, which is blood, and that's the only way that you'd be able to differentiate between the dandruff scale and the psoriasis.
So this is really an inflammation of the scalp tissue.
Yes. Unlike dandruff, which there is no redness or inflammation at all, psoriasis is always accompanied with inflammation or the redness, which is actually blood. So if you actually peel the flake away, you'll actually see bleeding right underneath the scale.
Really? Now, then there are different types of dermatitis.
Yeah, there's seborrheic dermatitis. There's contact dermatitis.
We're looking at seborrheic dermatitis.
Yeah, this is seborrheic dermatitis. Now, it's actually a scaling that actually takes place right around the hairline. Now, in infants, it'll actually be yellow in color.
In infants?
In infants, yeah. Infants can get this at a very early age. In adults, it could either be yellow or it could be white. In fact, another name that is many people refer to it is called cradle cap.
Really?
Because it actually happens right around the hairline. So if you just lift up the hairline, you can actually see this band.
So it's caused by an external irritation?
Yeah. Again, what happens here with seborrheic dermatitis, again, the cells are accelerating at a very fast rate. So it doesn't take the whole 30 days then to reach the top of the scalp.
What can you do to minimize it?
With seborrheic dermatitis, there are different type of topical solutions that we use to remove the scales from the person's scalp. But the first thing we try to do is we try to look eternally to see basically if the eternal factor can be corrected, such as if diet is a problem, then we'll show the person how they need to correct the diet. Stressful events will show them how they alter their lifestyle.
I've got a couple of more conditions to address, but before we do that, let me interject a question. Are there certain foods that seem to cause these conditions to appear more dramatically in other folks?
A high intake of animal fat will really cause the cells to accelerate at a real fast rate. So we try to take our clients, or I shouldn't say try to take them off, but we try to instruct them not to eat so much saturated fats.
Those shampoos that say for dry or damaged hair or for oily scalp, does any one of them appear to have appreciably a better effect than another?
The problem is that they tend to sometimes aggravate the problem. A person sometimes can actually have a reaction. We'll see where we've actually did a particular shampoo on a client, and almost within 5 to 10 minutes after we get them back to the chair, the scales begin to happen again.
And I guess it would be the same thing with dandruff. If you're trying to fight dandruff with a certain type of hair product, you might be exacerbating the problem.
Actually aggravating the problem. In some cases, with some of your dandruff shampoos, it actually drives